Hi guys, and welcome to another video. Today's video is going to be a little bit different just because I've been receiving requests from some of my subscribers and I thought it wise to do this video. So many people have been asking me to show like the equipment that we use on the Stepdown ICU unit, and so today I'm going to be making a video to show you guys kind of like the sort of things that we use on the Stepdown ICU unit. Now I'm in the room of one of my patients that I'll be expecting. Obviously there's no patient here, the bed is clean, and I'm waiting for the patient to come through. And I know you're hearing that sound. That is because this is a positive pressure room. Most of the times we put like TB patients in here, or like airborne precaution patients in this room, which is the reason why you're hearing that sound. So I just want you guys to ignore the sound and just focus on what I'm going to be saying in this video. Now, like I said, this room is currently empty. I'll be expecting my patients in this room. Currently I have 3 patients, and so I'll be waiting for my 4th patient. Patient might be coming from the ED, patient might be a step up from the med surg, just in case anything pops up like increase in oxygen, or maybe they need like a drip for blood pressure, heart rate, maybe a Lasix drip. Insulin drip in this hospital is typically handled by ICU, but in some hospitals step down take care of insulin drip. I know I've taken care of a patient on an insulin drip. Yeah, pretty much those are the kind of patients we get here. Maybe patients on dialysis, GI issues and things like that. Most of the times when you're expecting a patient, you want to kind of stock the room with what you anticipate that the patient is going to be needing. Now, just because I don't yet know what sort of patient I'm going to be getting, I'm going to be showing you guys kind of like the basic things that we're going to need for like a general spectra of patients that we typically receive on this floor. So some of the things I'm going to be showing you guys might not pertain to like a typical patient, but some of the things will be covering like a wide range of patients. Now I obviously have my things set up on these 2 tables, and I'm going to be going through them just so that you guys can have a heads up as to what we typically would be using. Now I am one of that nurse who likes when everything is in the room ready to go, especially when the patient hits the floor. If I didn't mention it, we are on a critical floor, and so we have the monitor. On the monitor we have like we are monitoring the patient's heart rate, blood pressure and respiration. And when the patient is being hooked up, then the O2 sat pops up. It's usually from counting from the top 1, 2, 3, it's usually the 4th one above the yellow number. Now I'm going to go across what you would typically expect in this patient's room. This is what the monitor looks like. Obviously the patient has been discharged. Like I said, the very first green one is the heart rate, this is the blood pressure, this is the respiration rate. And once you connect the patient, you're going to be getting your O2 sat. Now this is the cord connecting to the monitor. This is a continuous monitoring for the patient. I also like when my pump is ready to go. Here is the call light. Patient hits this whenever the patient needs me. This is like the rapid response code blue assistant thing if you need maybe another nurse outside to come help you in the patient's room. This is the oxygen, where we get to increase or decrease the oxygen depending on the patient's oxygen need and demands. This is the suctioning thing, where we connect like the external Foley catheter, or we connect the NG tube if the patient needs to be connected to an NG tube to low intermittent suctioning or high intermittent suctioning, but more so low intermittent suctioning. Like you can see, the green is low, this is mid, and then this is going to be high. You just get to turn this and to manipulate this, and then this is going to be regular, off, and intermittent. If the orders are for intermittent, which most of the time it is, you get to push this to intermittent, and then you get to manipulate this based on the pressure that is needed. I'm going to turn this off, And then we have a couple of plugs here just to plug like your IV pump. Moving on to the table now, if the patient is coming with an NG tube, this is the suctioning thing set and ready to go. And if the patient has a cough and needs to be suctioned, this is the oral yonker that the patient needs or uses themselves to suction themselves. So how this works is because the patient is not yet here and I don't know if the patient is going to be needing this, so I'm not going to be opening some of these things just because I don't want them to go to waste. So you just get to put this in, and it has like little holes at the top where you hook it to the patient. This is to the vacuum, this is to ortho, and this is this other one, the one with the white thing, is to the patient. Now this is the chalk. Most of the times you want to put it on the bed, especially for like patients who are incontinent, so that if they go number one, number two, this can kind of catch it without it necessarily soiling the bed. Most of the times our patients on this floor are kind of bed bound in quotes, and so in order for us to prevent the formation of blood clots that can lead to potential strokes in the future, we kind of have SCDs that we kind of hook them to their calf. If for any reason the patient is it's contraindicated for the patient not to have an SCD, we can always use a foot pump. Either that, or we put them on blood thinners, either the Lovenox sub-Q, heparin sub-Q, or they may be on Coumadin, they might be on Xarelto. But this is the ideal for most stroke patients. All stroke patients on our floor definitely will have this SCD pump. Now this is the wipes that we use to clean patients. Whenever they go number one, number two, we use this to clean them up. If for any reason the patient needs a urine sample, sputum sample, you've seen this on most of my videos. This is where we get to collect it, and then we put them in specimen bags. And the good thing about my floor is that we have a tube system which we just get to put it in, and it goes directly to the lab. Now this is Coban. I love this thing, especially in like confused patients or patients who have IVs in places where they're kind of positional and can come out. So this, you get to just kind of secure the IV place, the peripheral IV, just so that the IV doesn't come out. We normally call it here a Coban, but I think maybe other people might have different names. So the way you put it, it kind of gets like pressured or kind of has like additional squeezing ability that tightens up the place. This is also good if you want to do like a pressure dressing. If for any reason you want to pull out an IV, or you're trying to get an IV and the patient is kind of bleeding, when you pull out that catheter, this comes in very handy just to apply some pressure. Because like I said, when you tie this thing onto the patient's arm, with time it gets to be more pressurized, if you know what I mean by that. So this is going to be one table for the things that I normally would need for my patient. Now this is a sharps container. In every room we always have a sharps container. Moving on, if for any reason your patient wants to have like a bed bath and they need a shower cap, we have this beautiful shower cap that you just get to put on the patient. Most of the times it's always comforting, it's always soothing to put in like in the warmer. You put it on the patient, they just need to massage their head, and it's as good as it's as good as their hair is clean. This you don't need to rinse off. Now if for any reason the patient has like a PICC line, the patient has a Foley, we get to use a CHG wipes on them just to keep them kind of sanitized and sterile, especially also if the patient is getting ready for a procedure the next day. So this is a CHG wipe that we use on PICC lines, central lines, just to keep it sterile and clean. Another thing for personal hygiene, we also like to get them a comb. We kind of get a shaving cream and a razor just so they can do their personal hygiene stuff. And this is also a bedpan. The way this works is most of the time some patients, like I said, most of the patients on our floor are kind of bed bound, and so this comes very handy because if for any reason they cannot get out of the bed, we tend to just put in these chalks into this bedpan and then slide it onto their bottom, and they do their business, either number 1 or number 2, and that saves us from any fall risk for the patient. Moving on, if for any reason the patient has to stay in bed and they are a male, this comes in very handy for them. They get to use this for their number 1, and this is very graduated. So most of the times, especially if the patient is on Lasix and they are like a strict I&O, this comes in very handy. Also, we use this for patients who have Foley's, for patients who have basically anything that you need to empty which needs to be measured. This comes in very handy. But most of the times, this is used by male patients who need to do their number 1 in bed. Moving on, I know there's a lot of things in here, but I'm just going to take them out one at a time and show you guys what they are and what they are used for. If for any reason your patient is nauseous, these are Emesis bags. I like to always get 2 of these so that, you know, before it gets full or before the patient needs another one, you know, you kind of have time before getting a 3rd one. So these are 2 Emesis bags. Let's put this down. The next thing is going to be their toothbrush for their personal hygiene stuff. I'm going to keep this here. The next thing is going to be their mouthwash. The next thing is going to be like their cleanser or body wash, shampoo, for most of the times for patients when we need to give them a bed bath. Now this is a basin. We use this basin to give our patients bed bath. You just put like warm water, you use this and a washcloth, and you get to give them a bed bath while in bed, just so that you can prevent falls for patients who are like elderly or patients who are like don't need to put weight due to like a fall or a surgery that they had. And you know, this comes in very handy for bed bath. Moving on, if a patient is NPO, this is what we get to give to them just to moisten their mouth, and this one comes flavored, is kind of lemony. Most patients love this, but I can tell you that this is not as moisturizing as the next option I'm going to be showing you. So you've seen this in some of my videos. So what this does is, this is just a sponge. You just put it in a cup of water, it absorbs the water, and then the patient puts it in their mouth just to moisten their mouth. If for any reason the patient needs to be strict NPO, maybe they have an NG tube to low intermittent suctioning, for which they are trying to suck up everything in the belly, this comes in very, very handy so that they can moisten their mouth, because they will not be getting anything through the mouth. And you know how the mouth can be very, very dry if you're not getting anything through the mouth. So this we use for patients when we need to help them moisten their mouth. And we have Kleenex for patients who maybe have cough or they have a runny nose or they need to do other stuff. So yeah, we have Kleenex for the patients. Next thing, you won't be able to give your patient toothbrush without giving them a toothpaste. So this is a very handy toothpaste. The next thing is going to be a denture cup. Most of the time some patients have dentures, and so we get to give them this cup. You just put water in it and put one of these denture cleanser in it, and it sleeps overnight. Now most patients who are on BiPAP, it's never advised for them to be on the BiPAP with a denture on, and also it's never advised for your patients to sleep with dentures on. So most of the times the patients will take this out when they have to sleep at night, and so we get to put like clean water in here. We drop 1 tablet and drop the dentures in here, cover it up, and it is good to go. So this is their denture storage cup. The next thing is going to be their vital signs necessities. Now this is going to be the electrodes. We kind of this comes in 5 stickies. We get to connect these with these. This is the electrode cord. It has 5 cables, and we get to connect it to the monitor machine. Now for some reason I don't want to open this, or just because sometimes patients come from the ED and they already have this, or patients come from ICU and they already have this, so I'm just going to keep this here. If we don't need it, we'll return it. If we need it, then fine. So there's 5 of these over here. 5. There's going to be left arm, left lower, right arm, right lower, and the V, which goes in the middle or the center of the chest. So this gets to be connected to this. Moving on, we have the incentive spirometer. Now, I like to call this a hospital toy. That's how I like to call it to the patient. You see how the green thing is going down? So this is going to be a breathing apparatus which helps in expanding or opening up the alveoli in the lungs. Now, this is how I always explain it to my patients, especially patients who have respiratory issues and patients who come back from surgery. This is always my script. Hey, remember that you just came back from surgery, and when you were in surgery, you had a breathing apparatus that was helping you to breathe. And so because there was something that was helping you to breathe or helping you with the gaseous exchange, your lungs or your alveoli in the lungs were kind of closed up just because there was something helping it at that time. Now, when they come out of the surgery, it is always advised for them to use this just to open up those alveoli, just to waken them up and say, hey, whatever was helping you to do your job is now no more available, so you have to start doing your job as before. So what this does is you get to connect the white tubing, this one, you get to connect it here, and then the patient gets to swallow in the air. Remember, you want to open up the alveoli, so the patient needs to swallow in the air to open up the alveoli, and based on what their numbers is, we always encourage them to go up. So how you do this is the patient gets to suck in the air. I would typically do this 10 times. We always advise them to do this 10 times every hour, but of course, because we are night shift, if the patient is sleeping, there's no way the patient will just wake up to do it every hour. But we always say, hey, whenever you are up and you remember, please always remember to use this hospital toy. Now, when they swallow in the air, or when they suck up the air from this toy, the green thing tends to go up, and then depending on how high it goes up, for that 10 times you get the average of it. So let's say the patient is going between 2,000 and 2,500, you tend to get like the middle number, which is 250, and you document that as the number for the patient when using this incentive spirometer or doing this incentive spirometer exercise. So this is very good for patients who come out from surgery and patients who are like COPDs, or maybe patient, or maybe not necessarily COPD, but patient who have like respiratory issues. This is very good and comes very handy for them. The next thing is going to be a stethoscope. Now, like every nurse tends to have their own personal stethoscope, but if for any reason the patient is on precaution, maybe like a contact precaution, respiratory precaution, you want the patient to always have their own personal or kind of like dedicated instrument, or something that you can only use only for that patient in the room. So this is a disposable stethoscope. Might not be as effective as the Littmann stethoscope, but this still works. The next thing is going to be the pulse oximetry. So this, you get to stick to the patient's finger and you connect it to the monitor. So this is the pulse ox. Again, I don't want to open these things because they might go to waste if the patient already has one connected. So this is how you get to connect it to the patient. And I will tell you that most of the times, especially with patients who have artificial nails, sometimes it might not be as effective. Sometimes we'll put it on their head, sometimes we'll put it on hook it up to their ears, sometimes we'll put it on their toes. So depending on how how the patient responds. So this is very handy for us to measure the patient's O2 saturation in the blood. The next thing is going to be their socks. Most of the times we don't want our patients falling and getting into much more serious trouble, and so we get these like floor gripping socks. It's very nice. It kind of prevents the patients from falling. So we can use this for that purpose, or if the patient is complaining that they are cold, we use this on their feet. The next thing is going to be the blood pressure cuff. Obviously, I don't even need to explain this. This is very self-explanatory or very easy for you to understand. So you just hook it up to the patient and you hook it up to the monitor. So the blood pressure cuff. The next thing is going to be a cup. You always want the patient to have water just because they will be getting medications. And this is going to be, we call it like a toilet hat. So this, you get to put it on the toilet seat in the patient's room, just so that you can measure if at all the patient is very independent and can walk to the restroom. Whenever the patient pees, you get to measure it in here. So this is how this works. you just get to put it here. The patient sits, does their business, and then you come and you see wherever the pee is. Now we also have like the tissue, the wash hand station, the hand soap, mirror, trash, toilet paper, and all of that. Here is the sharps, or kind of the trash for the pulse oximetry, another trash bin over there. And yeah guys, this is what the patient room would typically look like. We also have the computer over there for you to do like your admission questionnaires. Now let me explain to you what this is. Remember when I said the patient gets to have like an SCD pump? So this, you get to hook it up to this machine, connect it or plug it up over there, and then hook it up to the patient's feet. What else do I need to show you guys? There's always like hand sanitizer in the room, and we have a couple of gloves over here, the patient's TV obviously, and the clock. And this, I shouldn't forget, if the patient should be coming with any personal belongings, we always have these belonging bags just to put their personal belongings in here. And if for any reason, if they have any other things, we get to put them in here. So guys, this is what the room gets to look like before the patient comes here. Oh, this is also the biohazard. I had a nurse whom I was trying to show how to do like a lab draw from a central line, and when I told her to dispose of the trash 10 ml blood, she actually threw it in the sharps container. And I told her that no, this is the container where you get to throw any liquidy thing that comes from a patient. If the patient has an NG tube that needs to be disposed of, you get to throw it in here. A Foley, you get to throw it in here. Like anything that comes out from the patient that is kind of liquidy, this is where you get to trash it. Now we have some extra room. Most of the times we keep like supply things in here, and we have an extra pump. It always is very nice if you have like 2 to 3 pumps in any room. So I'm very happy this patient is going to be having 3 pumps. And one more time, this is what the monitor looks like. I know the beds will kind of tend to differ, but yeah, for any reason, if you need to raise the head of the bed, that is it. If you need it to come back down, there it goes. If you need like the feet to go up, you do that, you press on this. And if you need it to come back down, you press on this. And if you need like a Trendele bag, or if you need in a different position, just kind of work this around. The patients also can either use their call light, or they can call the nurse by hitting this button. And when the patient gets here for the very first time, you take their weight from here. But before that, let me zero this bed. You zero the bed so that when they get in bed, you take the correct weight. And this is very, very handy, especially for confused patients who are trying to get out of bed. You want to always turn this on by hitting this, and depending on how sensitive you want it. So with this one, if you turn this and you hit this, if the patient just moves in bed, it goes off. If you hit this and this, if the patient sits at the edge of the bed, it goes off. If you hit this and this, if the patient stands out of bed, it goes off. And with this, you get to manipulate the volume of how loud you want the alarm to ring. I rarely see this being used, so I guess this is just for fancy over there. Now this is how we get to maneuver to unlock the bed. So now the bed is in this position and it is very, very much locked. And for any reason, especially for patients who are coming with like spinal injury or nervous kind of surgeries, depending on how they want the head of the bed to be, this comes in very handy. Let's see, in terms of like the angle that the doctor gave the orders for. So that is kind of like a quick rundown of what is in the patient's room when I am expecting my patient. So one more time, this is going to be everything I'm going to be needing. And this is also the linen closet where you get to change the patient. This is where you keep the dirty linens. I hope that this video comes in handy. I hope that it has kind of been enlightening and eye-opening. Obviously I am at work, which is the only reason why I get access to this room to be able to make this video. If you have any other questions, please drop your comments drop your questions in the comment section, and I'm going to make sure to make another video just to explain to you guys. I'll see you guys in my next video. Bye guys, and take care.